Module 4, Colposcopy. Most abnormal results from cervical screening tests show borderline changes, or mild dyskaryosis. The laboratory uses borderline changes as a holding category when it is uncertain whether there are genuine abnormal cell changes present. Although some CIN1, which one would expect to find on the cervix of a woman with a cytology result of mild dyskaryosis, may eventually lead to cancer, the majority of CIN1 heals spontaneously, and the cervix returns to normal. Therefore, following a cytology result of borderline changes or mild dyskaryosis, your GP may arrange for a further screening test 6 to 12 months later. Often, however, women with mild dyskaryosis are referred immediately for a more detailed examination called a colposcopy. A few women will have moderate dyskaryosis or severe dyskaryosis, which means they are likely to have CIN2 or CIN3 present on their cervix. These are abnormalities that are less likely to go away, and especially for CIN3, likely to progress to cancer if left untreated. Therefore, if the cytology test is reported by the laboratory as showing moderate dyskaryosis or severe dyskaryosis, you will be invited for a colposcopy shortly after receiving the results. You will be referred to your local colposcopy clinic, which is usually located within a hospital outpatients department. Colposcopy uses a colposcope, a specially adapted microscope, to view the cervix in detail. It takes approximately 15 to 20 minutes and is usually not painful, although it may be a little uncomfortable. The healthcare professional who performs the colposcopy, called a colposcopist, may be a doctor or nurse. Before the examination, you will be able to discuss your screening test results and the procedure itself with doctors or nurses at the clinic. Similar to cytology sampling, you will be positioned on a couch and a speculum will be inserted by the colposcopist. The cervix is painted with acetic acid and iodine to make any abnormal areas show up more clearly. A light is shone on the cervix, and the colposcopist will look through the colposcope to examine the surface of the cervix. A biopsy may be taken from any abnormal areas and sent to the laboratory for examination. This process takes a few working days, so if you have had a biopsy, you will be asked to come back to the clinic sometime later to discuss the result. If examination or the biopsy reveals only CIN1, the colposcopist will usually recommend repeat colposcopy every 6 to 12 months to see if the abnormality heals of its own accord, or persists and then requires treatment. In some cases, however, he or she may recommend treatment at the outset. If examination or the biopsy reveals CIN2 or CIN3, the colposcopist will usually recommend immediate treatment. Treatment consists of either cutting out or physically destroying the abnormal area, and a number of techniques are available to achieve either of these aims. Most treatments can be performed as an outpatient under local anesthetic,